Welcome to the Voyage Clinics podcast. I'm Dr. John, your host. Today, I'm joined by Diane Spangler. She's one of my favorite people. I met her a long time ago, and we just became friends in the community. And thank you for joining me on the podcast today.
My pleasure.
Let me just give a little bit of background and correct me if I'm wrong. I just kind of pulled this from some of your bio stuff. But where did you do undergrad?
I did my undergrad at Pomona College in California and Oxford University in England.
Oh, really cool. Okay. And then from there, you went to University of Oregon.
I did for my doctoral degree in clinical psychology.
Okay, and that's the Ducks. So do you consider yourself a Ducks? Let's go.
Not really, because then I did my postdoc at Stanford, and I am much more of a cardinal than a Duck.
Okay, that's fair.
But there's sort of a bird theme. So,
is that where you developed a passion for running? Because I know that the Oregon Salem is like huge on running. I went there a while ago, and there's runners everywhere.
So yes, Oregon. So that is where I developed my passion for running. So I've been running for a long time, and definitely since my Oregon days.
That's cool. And then Stanford, you did a fellowship there in the med school there?
I did in the Department of Psychiatry and Behavioral Sciences.
Speak to that. What did you do there?
So I, in my dissertation work, was very focused on depression. And then I did a internship at UC San Francisco. And then from there went to Stanford to do a research fellowship continuing my research in depression.
Oh, wow.
And then added on some additional specialties and also got to do quite a bit of clinical work. So a lot of my research is very treatment oriented. There's also some kind of basic science in there around emotion regulation and cognition. So Stanford had a very specialized postdoctoral research fellowship, and I was very fortunate to be able to work with them.
That's really cool.
Yeah.
That's really cool. We talked about a little bit before we sat down about Huberman being there as well. And Andrew, was he there when you were there?
I don't think so.
Okay.
I don't know.
He's one of my
personally.
favorite podcast guys. He's a super nerdy, like science guy. Well, that's really cool. What was it that drew you in this direction of mental wellness and healthcare, maybe in general? Maybe you could share some of your story.
I think it's always been an interest. So it was just sort of a natural interest. I used to steal books out of my dad's library when I was a kid. And they always seemed to be these ones around just human nature and psychology and philosophy. And so I think it was just a natural interest that started really early. But I was very curious initially about optimal functioning, like what leads to optimal human functioning, not necessarily physical functioning, but more mental functioning, emotional functioning. And in being interested in that, it sort of then led to what are the things that sort of block that? And then I just became very interested in depression and anxiety and then just continued in that area.
That's really cool. As a family doc, I have taken care of people for more than a decade. And I notice, 80% of overall performance in life is emotional. There's a ton of emotional involvement. I grew up in a small town in central Nevada, a little mining community, and we didn't have, there were no doctors for 5 hours. And there was a nurse practitioner that worked at the mine that did our sports physicals. There were definitely no, psychologists. There were no mental health specialists of any kind out there. And so we just kind of figured it out, right? Like we just lived life. And we went through some good, some bad, some ugly, right? Just like any small town or big town. And I remember in sports, because I played all the sports, any warm body in a small town's got to play sports. Like that's the rule. And so I played all the sports and did all the drama, I did choir. You did everything in a small town.
Jack of all trades.
It was really fun. But in the sports, I noticed my coaches were always saying, 90% of this sport is mental, and just sports can sometimes be a microcosm of life. And I think that's true in life too. I notice in caring for people, again, 80+% of overall health and wellness really comes from that foundation of mental health. Like if our thinking is good, if we have a good outlook, things go well in our bodies. But everything in life, I think, is biopsychosocial, and not just biology and medicine, we talk about like being very biology driven, evidence based and stuff. And that's true. But mental health is so important.
Yeah, so we often think about optimal functioning in terms of optimal physical functioning, and certainly want to be physically well. And some people take that to extremes and become, amazing athletes and things like that. And so there's often an emphasis on that. There can also be that emphasis on sort of intellectual, in school and wanting to be smart and get good grades. But psychological, or what you might think of as mental wellness, is certainly different from intellectual wellness, and that psychological, emotional really impacts the body, as you've just mentioned, that sort of mind-body connection. But also in thinking about, oftentimes people want to do really well in school and things because they want to have a good career, and that the stronger predictor of how well someone does in sort of career success is actually EQ, not IQ, although, both matter. And I think you're making the point that sort of that mental health is really important to physical health as well. And
can you speak to EQ instead of IQ? Because I know what you mean, but just speak to that.
So like emotional intelligence and psychological intelligence, and sort of knowing how to have good intra-personal awareness, meaning within oneself, knowing how to regulate and one's emotion, but also one's thinking. And how one views oneself and other people and things like that is such a huge part of being able to live a optimal kind of life. And it's probably the one that's maybe least emphasized if you think about schooling. And as we grow up, again, there's the physical part, especially for people that go into sports, but certainly people are concerned about physical health and even I think more so these days, people are concerned about diet, what foods are we eating, and that kind of thing. That seems sort of a natural thing that you pick up that people are concerned about. And going through school, the teachers and parents usually are real concerned about teaching you about intellectually, like you need to do well in school and you need to learn how to learn, and
you got to join these sports and do these sports and do piano.
And that the sort of mental wellness, psychological, emotional wellness isn't as emphasized. I mean, people are concerned about it, but we don't get as much education.
So true.
Yeah.
I would love to see an EQ curriculum in our schools, starting, I don't know, middle school, maybe earlier. Oh. Middle school needs it for sure.
Yes. And some schools do integrate it.
Yeah.
But it's not part of the curriculum in the same way that PE is, or sport programs are, or of course the learning math and science and in English and history and all of that. It's just not as integrated.
Right.
Yeah.
I'd love to see more of that. That'd be super sweet. When I was a resident in medical school, we had a PhD psychologist like yourself on staff to help both the residents and faculty kind of, navigate emotions and things, because residency is very stressful. 100-hour work weeks, really, really stressful. And so you got stress on the attending side, the old gray-haired docs that are teaching us, and then the resident side, the young docs who are trying to learn, and then everything in between. And she also would work with my clients. So she'd work with my patients. And I learned so much from her. And I thought, why isn't this taught? Like, why didn't I learn these really cool tools to navigate emotions and regulate emotions? And I mean, growing up in the sticks, my stepdad, or my dad, he raised me since I was little. Like, he was a military guy and he drank a lot, and his emotions were like, dude, that guy
all over the place.
He had like zero emotional intelligence, and he didn't. There was no emotional validation. Finally, my wife, a few years back, she's like, "Hey, you suck at emotional validation." And I'm like, "I don't know what that is, babe. Like, you got to tell me what do you mean by that?" And so like these little things, I think, are just, there's a paucity of teaching about it and talking about it. And so emotional intelligence, I would love to talk to you more about some of that and what we can do to just be more emotionally aware, and how do we, do better there? How do we increase our emotional intelligence?
Yeah, and when I think about emotional intelligence, which is really important, I can say more about that, but there's also a piece that sometimes gets missed when we talk about emotional intelligence. So it's certainly being able to recognize emotion, allowing for emotion, but there's also this other piece that I would think of as sort of cognitive or mind intelligence, in the sense of not in the sort of way you'd think about as an IQ or school, but being able to work with one's mind and one's thoughts. And oftentimes when we're talking about sort of EQ or emotional intelligence, people really are only referring to emotion. But so much of what we try and regulate is actually our thinking and our emotions as well. And those two are related. So I would just kind of expand it out that we typically don't learn very much about how do I handle my own mind and rumination and, different kinds of chatter. And because our minds are wonderful and very powerful, but they can also kind of mess us up and can actually create some really difficult emotion.
Yeah. I see some very common mental traps that people get stuck in with their thinking. Oh my gosh, what if? Creates tons of anxiety.
The what if thinking, yes.
Oh, what if this? And they're stuck in that and they can't recalibrate that. And it creates so much emotion. Coulda, shoulda, wouldas, like depression or just a lower kind of thought process. And then comparing ourselves. I think right now with social media and our teenagers, like there is so much envy, I would call it. I think there's a lot of anxiety, depression, emotions that they're construing as anxiety, depression that are actually kind of envy and comparing and contrasting and, oh, I'm not as good as, if only I could be as good as. And that's so hard with AI touching up photos and making everybody look perfect on social media and stuff. And
only posting the wonderful things as opposed to what's really real about one's life and challenges. And
my daughter kept a little podcast on, it wasn't a podcast, it was a, I don't know, Instagram has these little feeds, I guess. And she kept a little feed on me and she would sneak her camera up and take like video of me doing totally silly, totally ridiculous or saying ridiculous things. And at first I was like, hey, I'm a doctor, like maybe don't share that. But I saw that she shared it among her friends and her friends loved the vulnerability and just the normalcy that they saw there. And it gave them permission to be less than, right?
Yes.
To just be normal. And I won't even call them less than, but they just, in a world where everybody's trying to be better than, and I'm not as good as, giving them space to have just, I'm okay, And look at this guy. He's a doctor. He's so goofy, and he's like making a fool of himself. And I think there's a fun on my YouTube channel. There's a fun little video I did. I walked into her room and I was trying to get her to work out with me, and she was sleeping, and I didn't know that she had her phone like hidden, and so she had a ukulele on her wall, so I pull off the ukulele and I'm like, I'm gonna sing you this inspirational song, and I'm gonna try to. So I just start. And when I'm playing and singing, I close my eyes a lot. So I have my eyes closed and I'm singing and I'm just talking about the moment and just making up words, and it's hilarious. And she sneaks her phone up and starts recording, and she got the whole thing. So it's on our YouTube channel. It's super funny. But I think those vulnerabilities, like us being vulnerable, gives permission to our youth to be vulnerable, and that's really, really important. Okay, we've talked a good blanket foundation about emotional intelligence and these really cool things. I want to dive into your specialty, and I want to talk about depression, and then I want to tie in grieving at the end there just a little bit. I think grieving is so important, but we'll talk about. I want to hear from you in your research and in your understanding of depression. Kind of help us understand depression better. What is it?
So when people think about depression, they do typically think about it as a what is it, meaning like one thing. But depression is actually a group of disorders, so we call it a heterogeneous sort of category. And that there isn't just sort of one thing that's depression. There's sort of different types of depression, much in the same way that you might think about cancer, that we can talk about cancer as just sort of an overall label, but it really is a label for a group of different kinds of disorders that all like fall under the category of cancer. But if you think about skin cancer versus lung cancer, those are really different things in terms of what causes them, what risk factors are, how you would treat them, really what's giving rise to them. And the depression is the same way, that there's different sort of types and what would be giving rise to them, and then what you might do about it really differs. And that I would think about grief that you mentioned as being sort of along the spectrum of depressive issues. And some of these things I wouldn't even refer to as disorders. Like I wouldn't think of grief as a disorder.
Right.
And so at the base of it, I think about a depressive state as actually being a really useful part of what I would consider to be our loss system. So it's really important for us to be able to register loss of different kinds. So not just loss of other people that are important to us, but loss of values, things that we value. And so we need to be able to track that and know when we've lost something or are losing something, because usually these are things that we value that we're investing in. And so at the kind of base of it, that capacity to feel that sort of sadness, that withdrawal, that sort of lowness is important. If you think that you're losing something, you'd want to kind of take a moment to pause. So that you can recognize, like, why am I losing things, and I need to stop for a second and kind of figure out what's going on so I can do something about it. And so there is this sort of withdrawal part of it that's actually really important and useful, and helps us know what it is that we value.
Wow. I've had a recent experience with this, if I can share briefly.
Please.
So I love pickleball, play it a lot, probably too much. And then I hurt my knee and I hurt my back. And it took me out of the game. And I went to the orthopedic surgeon and we took some x-rays, and sure enough, there's some basically bone on my medial compartment on my right knee. And so now I'm thinking, can I recalibrate my life a little bit? And can I reprioritize? Can I rethink pickleball and its importance to me? It's a beautiful community, beautiful sport, awesome, really fun. And I went through a bluesy period here because I'm not as active, but then B, I'm losing something, right? And I'm like, ooh, and it's hurting me, and it's hard to kind of process that and recalibrate that. And so I started sanding a lot of serenity wood. That's been really helpful in pondering and looking at this piece of wood in the sun, and like and like finding. And I hunt a lot of mushrooms, and and so I'm thinking, well, there are some other places that I can fill my life with satisfaction. And turns out I need more time with my kids, and so pulling off of the pickleball addiction has been actually good in a lot is but you
also can change
really
your
difficult.
Investments, essentially.
Right.
Like, I have other investments, and they're important too.
I hadn't thought about taking the time to mourn that and taking the time to just process that as kind of a sad, hard thing,
Yeah.
That's cool.
So I would say that depression stems from, if we're going to kind of think about it in a global way, disruptions to that system that we all have built into us, which is really important and very healthy and necessary to have that. But it can get disrupted in different sorts of ways, and there are things that it's connected to. So if I think about different sorts of established subtypes of depression, now I think we've got more research to do to kind of carve depression at its joints, so to speak. But if you think about something like seasonal affective disorder, that's seen as a sort of a subtype of depression. But again, going back to that cancer analogy, what's really causing that is really more disruption to the circadian rhythm. And so the way that we would treat that is really different, and that there's a circadian rhythm piece that is part of that loss system, right? Like how active we are versus how quieted we are. The circadian rhythms, about that, and, light exposure has a lot to do with that, but it's about sort of activity versus sort of quietness. That circadian rhythm influences that. So if that is disturbed because someone has seasonal affective disorder, then they're going to be in that more quiet, depressed, I'm going to call it kind of a loss state, but it's for a reason that doesn't have to do with direct loss.
Right.
Right?
Right.
But I would say that the vast majority of people, when they're talking about depression, often get there through some sort of loss event. So that's certainly an important pathway to depression as well. There are other kinds of what you might think of as biological things that disrupt that system. So hormones are a part of that loss system. And so if you think about postpartum depression, for example, I think there are ways that system, I'll call it the loss system, can be influenced that are potentially purely biological. So there's these different pathways.
Yeah, that's super, super interesting. Which ones do you see most commonly, maybe in your practice?
So I see, what I would think of as depression that comes through various kinds of difficult events. I also see people who depression gives rise. I also work in a neuro clinic where we work with a lot of people who have had concussions. When they have a concussion, they have some traumatic brain injury sorts of symptoms, but it usually then means that they can't go to school, or they have to lose their job, and so they develop depression because they have to withdraw from their lives because of their symptoms. And you could think about that for a lot of different situations. Like you mentioned, your knee made you pull back from knee injury, made you pull back from something that you really cared about. And so there are these sort of interaction between all different kinds of loss, transition, change events. So even transitions like child going off to college, or, these are, so again, when I'm talking about loss of all sorts.
It's like you're talking about me directly.
It's,
like both of my kids went to college. I played pickleball. I lost that.
Yeah.
So
it's sort of like life. People get depressed because of life, and so that's probably the depression that I treat, that kind of a pathway.
The quietness, I love how you described that. I'd never heard it described as like just that kind of loss quietness. And there is a quietness to our emotions, and then that quietness can then become a spiral down into some really deep, dark spaces. But the quietness is not necessarily bad. It's like it's an okay thing to see and to process, and then to pull maybe up from, and not allow ourselves to spiral kind of down in our thinking about that quiet space. Can you kind of, I don't know what I'm trying to say here. I'm not an expert.
I think you're drawing the difference between what I would think of as genuine sadness, which is really important, and then depression, where it's become something that's problematic and you get stuck in that state and feel very stuck, feel very hopeless. Whereas genuine sadness is in some ways this sort of beautiful, bittersweet kind of almost a celebration, in the sense that, not that it feels, like a party, but it can be a recognition of what really matters to you.
This is exactly what happened to me this last summer. I spend a lot of time up on the mountains hunting for mushrooms in the summer. And most of the time I'm by myself and I'm hoofing around in the forest, and just, it's a great time to just contemplate and process. And there's some EMDR there where you're scanning the ground, and you're kind of processing and thinking, and you're looking for, there's a mushroom, and then dopamine. And so it's really cathartic for me. It's very therapeutic. And I was up there.
I can see that.
I was up there, and my daughter went to college, and my son went off to college. And I just took time to just mourn and celebrate that loss. And I loved how you said that, like it's a sadness, but then there's also like a celebration there. And I was super happy for them, like super great, but also sad that, I don't get to spend time with them as much anymore, and I don't get to hang out with them. And so I think it's neat that the way you're describing things, way better than me, but because I don't know.
I think what you're pointing out, certainly celebration that they're kind of moving into a new phase in their life and have all these opportunities, but more a celebration or beautifulness of the fact that you have developed that kind of a attachment and caring and love for another human. And that's a incredible capacity, and one that ultimately brings a lot of joy. And so when that gets disrupted in a way, and that you have more separation from them, then you really are experiencing at the same time both sides of the coin, the love and then the sadness at the sort of change in how how much you get to be with them, or how that love gets expressed or experienced.
I love this, and I like how you distinguish kind of what I was talking about with like those still, quiet, sad moments from true depression.
Yes.
And ways to...
Depression, I would think of as a disruption of that system.
Okay.
So again, there can be that very bittersweet to genuine sadness.
Yeah.
There's always the flip side that is really about loving something, valuing something, even if that's a valued idea. So if you look at the kinds of life events that predict the development of depression, they're typically loss-related ideas, loss-related events, either of a loss like we've been talking about, or the loss of a cherished idea. And so again, they can be very broad, but it is an indication of what we value. And so that genuine sadness it's important to know what that is and to actually not label it as depression.
Right. And to give permission to be there.
Yes.
And that it is normal and okay. And
important to be there.
Just like giving permission to be vulnerable, to be normal, to have bad days and good days. And I think that, tell me about that important to be there piece, because that's really cool.
Oh, well, if we take your example of your children going off to college, so you're there and you're having a quiet moment, kind of mushroom hunting and up in
Crying,
the mountains.
I was bawling. Yeah, it was great. I was watering the mushrooms.
So did it feel valuable to you to feel that loss and feel how much you love them?
100%.
If you were to avoid that or try and distract from that or tell yourself, I'm not supposed to feel that, likely that's going to lead you in a direction away from genuine sadness, but into something that's actually more dysfunctional. So if you want to distract from it, you might drink, or you might spend all this time scrolling on your phone, or you might, and that actually takes you away from those more meaningful kinds of feelings.
I think it also takes me away from the deepening of my relationship with them by doing that.
Yeah.
So I
So it takes you away from joy, really.
Yeah.
Yeah.
Because I changed.
I do love those kids so much.
Yeah.
Like, I have things that matter in my life. And,
Yeah.
And I have the capacity to love and to care about them. And I can kind of direct that in a lot of directions. And I continue to direct it towards your kids. But like you said, I realized that then, it also means I can direct that capacity toward other things. And
Yeah. I came off of the mountain raw, but very grateful. And actually, I expressed more gratitude for each of them that day. I called them and told them how much I love them and stuff. And it healed something in me. And it was really great. And I thought, oh, that's neat. And I love that. Yeah, I think we're hitting this really beautifully, that allowing ourselves to be sad and the importance of sadness and giving time and space to that emotion, and not just suppressing it and pushing it away, but actually just being there and just having it.
Yeah, and it says something sort of beautiful about you and what you care about, and to be able to be in that. So definitely want to maintain that capacity. But really, it can get twisted when people think I'm not supposed to feel this way, or that the sadness is actually based on distortion.
Tell me about that.
So sadness can come about because people are thinking about things like, oh, I didn't do well on my exam, therefore I'm a loser and I'll never get into college, and I'm going to, there's just sort of this hopeless.
Mm-hmm.
That I wouldn't say is genuine sadness. That's what I would say would be sort of hopelessness and sadness based on a distortion, meaning not doing well on one test doesn't mean you're going to fail for the rest of your life, or that one should never fail or never have something that's difficult. So you might feel like, oh, I'm disappointed that I didn't do well on this. Then I can use that as motivation I really do care about learning, and I really do. So that's where it can veer into depression it really depends a lot on how one handles those initial feelings, when one does have some sort of a difficult loss-related event.
So what you're saying is that they're distorting the picture by not just processing that thing, but then jumping to other conclusions based on that one thing that, gosh, I did poorly on this test, therefore I'm never going to succeed in life ever.
Yeah, so
it just distorts it into
so if you let's say you have those
Mm-hmm.
some sort of sense of loss because you did poorly on an exam,
Sure.
or maybe
Or a
talk about a high
sport
school
or
student
pickleball.
or whatever. That some of those initial feelings are probably going to be really useful. Like it's probably a good thing that you don't, if you didn't care at all that you did poorly on an exam, I'd be a little more concerned. But so it's like initially, like I feel that it registers. I wanted to do better. Okay. But there's so many ways that then that gets interpreted, some of which can lead you down a path to depression, not a path to staying with the genuine sadness.
I'd love to speak to more ways that that process gets disrupted in a dysfunctional way, leading to depression. What are some other distortion we talked about? We talked about suppressing those emotions and not processing them, and that leading to badness there emotionally. What else have you seen in systematically not processing that sadness or loss process well that leads more to clinical depression?
Yeah, so you mentioned suppression. I'm just going to talk. So again, distortion, the way you interpret whatever those sensations are, I think is very important, or whatever the event is. So that can kind of lead you into genuine sadness or can lead you down the path to depression. There's like a multitude of different ways things can be interpreted that could lead you toward depression or toward anxiety or anger or what have you. But suppression is actually a very common reaction to what you might think of as painful emotion, whether that's, again, depression, anger, anxiety, jealousy,
Sure.
And that it seems in some ways almost a natural reaction, but also certainly a learned one, that many people think I'm sort of not supposed to feel these things and I need to get away from them, or I don't want to feel these things.
I'm a man, I'm not supposed to cry.
Yeah,
there's tons of that.
Yeah, certainly. There's that one that
Or
I
I'm
think
an adult,
men
I can't be sad.
Yeah, or I'm not supposed to have these, or it's wrong to have these. I'm not supposed to be angry ever. Makes me a bad person, or and so suppression or avoidance. And there's lots of ways to suppress and avoid. That's a really problematic response to those things as well. Although on occasion we need to use it.
Totally.
You're in the middle of something and you're driving or you're at work or something and something, comes up and you've got to be able to distract away from it.
Yeah.
And you had mentioned before being a resident and just, you're in the middle of doing a surgery and it's not going well. You can't dive into the emotion. You got to stay focused on what you're doing.
Yes.
So I don't want to vilify the use of distraction or suppression at times. It's just that for many people, that's the way they handle negative emotion or painful emotion.
What's the sequela of that? Like, what's the result of doing that over time and not, whether it's anxiety, depression, or anger or anything that you're kind of suppressing? That is there negative outcomes from that? Like,
yeah. So. There's a lot of potential negative outcomes. So the way that one uses suppression or distraction, the sort of way one does that can lead to problems in and of itself. So the easy example is like people
alcohol,
drink,
yeah.
but there's so many of those that you could get lost in video games
Totally.
or, these sorts of things.
Escape to another world,
Yeah,
doom
dissociate.
scrolling.
And so all of those sorts of methods can lead to all different kinds of issues. But to not process those things also kind of feeds back, like you were saying, that there's actually something very meaningful about being in the sadness about your children. And it ultimately led to this deepening of your experience of life.
Mm-hmm.
So you miss out on that if you're going to suppress, but you also miss out on processing whatever the event is. And again, in the moment, it might not be the time to really process it. But if something is giving rise to emotion, that's one of the ways that we know something important is happening, at least important to us. And it might be important for distorted reasons, or it might be important for very genuine, great reasons. But if we keep pushing those things away, we never do that processing. And there can be a sort of a roboticness to life that comes in because you're not fully living it. So, kind of going back to the philosophers from, thousands of, I can't remember who said the unexamined life isn't worth living. I don't know if it was Aristotle or Socrates, but it's sort of that you pay that price. And that if you think about if you're always in kind of a distraction mode and you don't really get into your life and process it, I think that's what, again, I think it was Socrates. I think that's the point he's making, which is right on. Like life loses its richness and you're just sort of a little bit of a robot out there.
Fascinating, because one of the most common symptoms of clinical depression is anhedonia,
right,
which is I don't feel anything.
Yep.
Things that brought me joy don't bring me joy. I'm just basically a robot emotionally.
Yeah.
And maybe that's one of the spaces it comes from is this suppressing emotions and not feeling them, not allowing them. And then eventually your body says, okay, this is us. We're a robot.
Yeah.
And so that's really unhealthy.
Which when one is feeling a lot of pain, that anhedonia or numbness in the moment can be kind of attractive. But then when it becomes this sort of habitual, people will say, feeling nothing is worse than feeling something.
Yeah. Oof. That was really deep. And I see a lot of my patients doing things like cutting and things in those states because they want to feel something.
Exactly.
And that's where they're turning because they need. They're just like in like despair about it. Really tough.
Yeah.
What are the could do's when we are in those quiet sadness spaces? Ways of maybe these are the things we could do that might avoid clinical depression, that might help us healthily process emotions and avoid maybe set up rituals where we have time to process. And I just stumbled upon these rituals of sanding wood and spending time in nature, hunting mushrooms, and it turned out to be a wonderful emotional processing time for me. I think we're all guilty of some degree of disassociation through doom scrolling or video games or diving into a book or whatever, like just pulling away. But maybe that's okay for a time, a season, and then maybe being deliberate with our emotional processing and saying, I'm going to spend time 2 days a week.
Yes.
I don't know. Maybe just schedule it.
You're right on. So I do want to underscore a couple of things that you just said. One is that using distraction or escapism or those sorts of things from time to time or whatever, absolutely. And sometimes we need it.
Yeah.
It's like I'm not in a place right now where I can go there for whatever reason. Either it just feels too painful right now or I really am needing to direct my attention towards something else. So again, I don't want to vilify the use of distraction and escapism, but it can't be the only thing. It's to be used in as a tool from time to time. Then what does one do, when you do want to process, because you want to make time for that as well.
Yeah.
And so what you were describing is the sort of things that would have people do. So there's the work by Pennebaker. I don't know if you're aware of his work. So one of the things, if someone is in a sort of high emotion state, and it's a painful emotion state, or you could do it with any emotion state, even a joyful one, is that when we're having those pain states, typically there is a lot of kind of pinballing going on in the mind. And our mind is most people's experience of their mind space is pinball-ish. It like just jumps all around.
Yeah.
And so making time to actually write that down. And so Pennebaker talks about it, and a lot of research on that, just in like a journaling sense is one way to do that. Is to just kind of do a spill onto your computer or, in a journal or, writing with paper and pen. I don't know if anyone does that anymore.
Old school.
Old school. But letting it out and giving it a structure. So you can do that by writing. There are also other more structured ways to do that by like things called like thought records, where you can start to write out what are the thoughts that I'm having. And then the thought records can kind of guide you through which of these thoughts are actually kind of related to, in this case, we're talking about sadness, like my genuine sadness, or maybe allows you to step back and which of these are kind of distorted. So there's some great kind of books and thought record sorts of things to do there, but it's in parts kind of stopping the ping-ponging so you can get it out and actually process it. There's also a really great app that allows you to do that.
What's it called?
It's called the Feeling Good app.
Cool.
Yeah, and it really has a very nice structure. And the great thing about an app is it's sort of right there on your phone, and you can do it anywhere, and you can do it for a couple minutes or, for an hour, or and it actually has a AI that kind of guides you through it, and you can talk to the AI or write to the AI. And
the emotional distortion that occurs in this emotional process, because I'm thinking of my teenagers and their emotional distortion. They're very predisposed to this, right? To distorting their emotions, and they get into these like woe is me things, and that's hard to, because you want to emotionally regulate that, but then you also want to say, could it be that some of these emotions are just a little distorted with your irrational thinking right now, right?
Yeah.
You're thinking 10 steps down the road, and I don't want to take you away from this emotion. I think it's an okay emotion to have, but I also want to just at least look at it as possibly being just a little distorted, and then just being aware of that. This was really enlightening to me, that using that word distortion is so true. And, they jump to conclusions about it 10 steps down the road. Then, if this, then that, and that.
Yeah.
And it's so distorted, it's not real. And same thing with like coulda, shoulda, wouldas, if only I could have, shoulda, woulda done that thing. And that's a degree of distortion there. Comparing oneself to another person, that's another lens of distortion.
Yes.
So these phrases that I was talking about that I see lead to anxiety, depression, and on these clinical situations, they're what you would describe as just lenses of distortion to those emotions.
Yes.
That's really
and
cool.
the sort of the thought record, the kind of books or this app I'm talking about will actually identify how people learn the most common forms of distortion, like all or nothing thinking or fortune telling or emotional reasoning, and there's a whole kind of list of them that people learn, and then you can catch them in yourself. But one of the things that you mentioned, which again I want to underscore, is that the emotion that someone's feeling often has a component, or what I would call a kernel of truth, of that genuine sadness, anxiety, whatever. I mean, there are things that we need to be anxious about, in the sense that I do have an upcoming thing I need to prepare for. And anxiety is really, we have it for a reason, because it helps motivate and focus us for a potential upcoming challenge.
Sure.
So we do need to do some what if thinking. What if my house catches on fire?
Right.
I probably need to get home insurance, that kind of thing.
Sure.
And we need to prepare for stuff. Well, what if when we go on our trip, I get a headache? I probably got to pack my aspirin, sort of a thing.
Right.
Or a sunburn, and I need to bring my, So having the ability to do kind of what if thinking, which is more of an anxiety based, or being able to evaluate something that feels like a loss. So that's the reframe part, is finding the kernel of truth in it, but then also being able to recognize the distortion so that can get
Pushed
blown
off.
away. Yeah. So
Super cool.
Yes. And
You taught me how to emotional regulate. That's really good. This is really cool.
And part of, I think, the mistake in some approaches to emotion regulation is this notion of vilifying emotion.
Right.
We need to get rid of it. Emotion's bad. I need to.
Right.
And so you got to find the kernel of truth, which also helps you recognize the distortion. But these are all things people are actually pretty good at learning when they have the right tools.
Yeah. So I came into our discussion really wanting to talk about grief. We talked about hospice, end of life, death, and dying.
Yeah.
I talked to that with Dr. Dave a couple podcasts ago, and I've been wanting to speak about grief, and you advising me to come at it from a broader scope of this sadness and depression and processing has been genius. Thank you for your genius. But it's been really neat because I've learned so much about grief processing just in understanding emotions, emotional regulation. And tell us that app one more time. What's the name of it again?
Sure. The app is called the Feeling Good app.
Feeling Good app. Okay.
And it's available
Cool.
in app stores. Okay. And the creator of that app is actually a friend of mine, and I continue to do research with him. He's one of my mentors at Stanford from years ago.
Yeah.
His name is David Burns, and he has a lot of very useful ways of working with different types of emotion and one's thinking and how that impacts. But for the grief part, that there is a lot of genuineness to grief, and again, grief is often the flip side of what you really care about and love. So we hurt where we care, and we care where we hurt, and so. Finding that sort of beautiful part of grief that, yes, I really did love my work at this place that now I can't do, or this person that now has either gone off to college or died or whatever. But you'd mentioned this as part of being in a residency where you lose patients, and that some of that is the person themselves, but some of that is probably this sense of like, it really matters to me that I can help people and help them heal. And when that doesn't go, like I can't prevent death, but I feel that. Mm-hmm. And that is a reflection of how much you actually want to heal people. Mm-hmm. But then we attach all this other stuff to it. I'm not saying you attach this, but then it could be, I'm a bad doctor. I shouldn't have gone into this in the first place. I should push away my grief. As a doctor, I should be scientific and not care about grief, or not experience it. I should be tougher, or I should be more hard-headed, or I shouldn't have cried to the patient's family, and I'm embarrassed now, and they're going to think I'm some sort of weak mess. And so that's all the distorted part of grief. So what did this mean to you is both in a genuine sense, what does this mean to you that like, I couldn't have healed this person, and I feel that because that's what I want to be able to do. But then what does it mean around that, and then oftentimes that's where you run into the distortion. So that's where the work comes. And you were sort of talking about your teenagers, that you can see that there's a kernel of truth in what they're experiencing, and you don't want to squelch that. And yet you can see that there's all this distortion too, like, oh, now I'm going to be a failure, and there's no point in doing anything. And that teacher ruined my life. And you're like, okay, come on now, But at the heart of it, they want to do well in school. And like, I can get on board with that, and feeling like I wanted to learn, and I thought I really studied, and I'm feeling a little stupid at the moment. It's like, that I'm glad that bothers you.
Yeah.
Right?
I love this.
But it doesn't mean you're a failure in life. It just means, well, sure, we all make mistakes and fail sometime, and so let's learn from it. Well, what do we know about that? Doesn't make you a loser, or
Yeah. And that's the benefit of talking with someone like you is we can just talk about it. We kick it around and look at it, and then you help me recognize the lenses of distortion that I'm using on this picture.
Yeah.
And maybe bring in some healthier lenses to view it with.
Well, and tools to know how to do that, how to recognize in yourself and sort of get there eventually. Like my goal in working with people is to eventually make them their own therapists. But that ping-ponging I was talking about, the pinballing of the mind, that sort of writing things down, talking with a therapist, that helps with focusing, so that you can get to what are all the meanings associated with this? What are you saying about the emotion itself, but also where it came from, right? So there's the genuine part of it, the kernel of truth, and then there's usually a lot of meaning that once you kind of get it out and identify it, you can recognize that like, oh, that doesn't really make sense. Like I guess we're using this sort of test-taking example, but yeah, I did kind of do poorly on this test. And so maybe there's some things I don't really understand about this particular concept. That doesn't make me stupid and a failure, and I'm never going to graduate from school, or, and I think I'm pretty glad that it matters to me that I didn't learn this very well. Yeah.
It's so interesting that you say this pinballing effect. In in medicine, as a family doc, I see a lot of people with trauma, a lot of people with these emotional dysregulated states, and a lot of people with ADHD. And it's fascinating that trauma, post PTSD, can present almost exactly like ADHD. And I think it has to do with that pinballing that's going on, and they're not able to really organize it and structure it and process that. And I wonder if now, this is totally spitballing, but I'm just seeing upticks in emotional dysregulation and ADHD, right? And I wonder if those two aren't in sync with each other in our society, where we thought the opioid epidemic was bad. I mean, you should see the ADHD epidemic. Like, what the things that we're using to treat ADHD, these stimulants and stuff. And there's like tons of it out there. And I wonder if just emotional regulation and processing would stop some of that pinballing and then help people just focus, just come to center, come to that sea of glass moment emotionally, and then be able to perform better in their lives.
Yeah, so there is this relationship between high emotional state and high pinballing. So they feed each other. So the more you're pinballing and jumping around, the more dysregulated the emotion gets, and the more intense the emotion is, you might get more pinballing. So just in sort of a day-to-day, examples, that when people get really upset, it feels like their mind is jumping all over the place. And this kind of goes back to what I said at the beginning of the podcast, that oftentimes when we're thinking about emotion regulation, we focus only on emotion, and we forget that there's this psychological mind regulation it's sort of part of the whole thing. And so it's sort of mind and emotion, and certainly they interact. So being able being able to direct one's mind, or what you might even call attention, is a huge part of emotion regulation. Yeah. And I'm talking about directing it in a particular way. It's not just directing it like I'm going to direct it away and to just focus on something else, which at times you might want to do that. But being able to direct attention and stop the pinballing, or at least grab something and go with it so you can actually process it, that is what sort of leads to the emotion processing. So in a way, emotion processing is actually cognition processing.
Wow. That's probably why the Serenity Wood works for me, because it's my emotions, it's my feelings. I'm like feeling and looking and seeing and using my senses to kind of ground into the now.
Yes.
And then I can just...
So it's focusing.
It's just helping me kind of focus down on what's going on right now.
Yeah. And it's probably soothing, sort of physiologically soothing to be, playing with a piece of wood. And so there's a body component to it too. And we really haven't focused on that, which is fine. It's kind of a whole other can of worms.
That's another podcast.
Yes, that is another podcast. But, being able to soothe the body and the nervous system is important as well as part of that grounding. But the grounding is also an intentional mental grounding. And I meant attentional, not intentional, grounding. So when you're talking about these seemingly relationships between attention dysregulation and emotion dysregulation, absolutely. Because one of the things you have to be able to do to regulate your emotion is to actually be able to regulate your attention.
Yeah. Wow. This is super cool. I want to talk just briefly a little bit more about grief. It is something that's very, very difficult. And I think a lot of my patients struggle in this space of just grieving a loved one and death. Maybe we'll talk about grief of a loss of a loved one a little bit specifically.
Sure.
I'm well acquainted with this. I lost my older brother when I was a junior in high school, going into my senior year. He's 2 years older than me, very, very close. We slept in the same bed. We were kind of bored. We lived in like this little tiny house and stuff. And that was paralyzing for me. That was really, really hard. My other brother died when I was in medical school. And so it's just hard. And then medicine, there's loss there with a lot of, I love these people, right? I love these people. And I lose, an older person doing hospice. And then I'll, delivered babies and, had a big like in utero loss there where a baby died in utero just like the day before it was supposed to be born. And that was a huge, huge suffering with the family, with me, with the nurses. We were all bawling in that room.
Good for you.
Yeah, I think it's great. The
Yeah.
vulnerability space, I think, where we have to tuck away our emotions is somewhat true, because we can't be crying during surgery, but
Right.
so we have to suppress for a minute. But man, roll back on that and really process that. And I think it's just it can be really, really difficult to lose a loved one. My dad died this last year. My wife's dad died this last year. I lost a really close patient this last year in his 50s, and that was really, really challenging for me. And all of the distortion lenses that you described was like you were talking about me, because those are just we see that.
Can you be more specific?
Well, just as physicians, sometimes we're like, this is if I would have done this differently, maybe this would have been different. Is this my fault? What in the world? And really taking that grieving process is really tough. And for these families of these folks, it's been really challenging. Now they're in super anxiety land about, well, what if I die early? And their anxiety levels are super high. They're very emotionally dysregulated, and you see the lenses of distortion that they're processing some of this through as well. And it's hard for me, right? It's hard for me to watch twofold, both because I'm mourning the patient still, but this papa, and I'm also mourning with their loved ones as I help them kind of process this loss as well. And so I think processing death and dying is its own ball game. And are there healthy ways of like looking at that and doing that and allowing those waves of emotion to just, because those waves of sadness are so much more poignant, and that those moments of that still sad moments are super, super hard. But allowing, I think, for me, at least for my brother, I cried for a lot. And my town, so I lived 15 miles down the valley from my small town of 800 people, because my dad didn't like people very much. So we moved way out in the boonies, dirt road. And in a small town, we know everybody, like the football coach, the choir director, like
strong connections.
All the teachers know. Yeah. And so all of his teachers came out to the house, and all of his football coach, and like all the players. And I remember I was crying for the first, a lot of that. But then after a while, I was comforting the people that were, because they were mourning, they were in a higher state of mourning than I was in eventually. And I think it was such a beautiful coming together of the community, because they all knew him. My brother Joe is just super, super loved in the community. And I don't know, I think I processed it without any help, and it was challenging. My brother got really angry and never really stopped getting angry. He was really angry about it.
Yeah.
My mom really suppressed it, and she wouldn't allow pictures. She wouldn't look at it. It was too hard. It was too sad. It was
too painful for her.
It was too painful.
Or at least that's what she was telling herself.
Yes.
Like, I can't let myself feel the pain, or else. Yeah.
Right. And so both of those are maybe distortion ways of processing that grief. I just let it roll through me, and I just allowed myself to cry and be sad. And even now, like I still can put on a distortion lens and say, man, if Joe was here, right? And I can cry and I can feel a lot of grief about it. I don't let that lens stay for so long. I pull it away. But I allow for some of those grief moments to still hit, even years and years later, right? Years and years and years. I'll still have a good cry. And it's fine. Like I pull through that, and but I haven't been given the tools that you're talking about. And I think that some of those tools might help me and my patients as well, like in processing some of these losses of loved ones that we go through.
Yeah. So one of the things that you illustrated very well is how individual the response to a loss of a person will be. And you mentioned your mom really felt like I sort of can't tolerate thinking about him, or don't want any grief reminders, don't want pictures, don't want, and so that was her way. So your brother got really angry. So I imagine that he, if that's what you're observing, he's probably having a lot of sort of his meaning is this shouldn't have happened. It's unfair,
Yeah,
or
right.
blaming the universe or God or
Yes.
somebody. You know, someone's at fault, and I need to fight this, and this is wrong, and so in that sense, it's going to be really individual. So part of grief processing is going into whatever your responses are. And for all, you know, your mother, your brother, you, at the core is always going to be something about love.
Yeah, that's true.
And that's the kernel of truth. That, again, we hurt where we care. And so the being able to bring out the love part and what is it that you do miss? So it's a going into. And then as you do that part, the distortion parts come out too, and you can process those. But it's not something that is necessarily fast, and everyone's process is different in terms of timeline. But everyone's process is so different in terms of meaning. And the meaning isn't a single meaning for each person. There's multiple meanings for each person. There's the part that like, wow, I really love this person. I really miss them. And I really, and that's the kind of grief that sounds like you're experiencing from time to time about your brother still.
Yeah.
That you still love him and you still miss him and you still wish he was here for Christmas or, know. And it's like, yeah, I do really love that guy. And so you can kind of be with it. So that's part of the kind of grief processing that I think is really important for people to do. But a lot of the times they don't do it, and oftentimes aren't really allowed to do it. That there's this the way that they treat themselves in their grief, but the way that the people around them, people want to cheer them up, or, well, they're in a better place, and they say these sort of like things that are often really aggravating the person that's grieving. They're just trying to minimize the pain in some way. So for sort of beginning steps would be to go into your pain so you can see what it's teaching you, about what you love, about what matters to you, but also what meanings you're pulling out. And it can be this really self-aware kind of a experience where you can learn some really interesting things about yourself. Like, I'm saying these sort of things about your brother that are kind of hypothetical because obviously he's not in the room and I don't know him. But my guess is he's got a strong love for your brother who passed away when you were young. And then this whole anger reaction says something interesting about him that he could learn about himself. That man, I'm really a fighter here. And who am I trying to fight? Or what am I trying to fight? And am I trying to fight some existential injustice of life that our life, everyone's life ends, or I don't know. That's just an example, but you can really learn a lot from your pain. And one of the things that you maybe noticed about your mom is she didn't want to go to her pain. And that's a common response too of pain of any sort. People are afraid if I go there, I'm going to fall apart, or I'm going to go crazy, or I won't be able to stand it, and so there's an importance to exposure, but there's so much that can come out of one's willingness to go into the grief rather than go away from it. I should be over this by now, or okay, he died, there's nothing I can do, so I might as well, It's again, it almost goes back to that, the unexamined life isn't really worth living.
Right. Yeah.
Feeling pain has got a lot of meaning in it.
Lean in is what I'm hearing. My mom has done much better over the years is leaning into that pain and seeing it. And she can now, she can see a picture of my brother, and it's not. And I love what you said about just leaning into however we're processing that grief.
Yeah.
Whether it's anger, whether it's fear, whether it's suppression, and just lean into that and see what that is teaching you about yourself. And where is that love truth in your heart about that distortion? There's a kernel of truth there.
Yes.
And
oftentimes when you can go into the kernel, you're going to want to address the other things that surround the kernel. But when you go into that kernel, there is this such a bittersweetness to it.
Yeah.
And that's when people feel like they're healing.
Yeah.
You know, like, so tell me, what do you miss most about him? And what was unique about him? You know, that, yeah, he was really outgoing, and he really knew how to put people at ease. And he's funny, and I just loved being around him. And that, you know, to be able to experience that and feel that kernel of truth, that's where people feel like they're healing. And of course, kind of needing to work through some of the other things that surround the kernel of truth, that's important too. But people, oftentimes, the people around them try and take them away from the kernel.
Yeah.
Because they think it's going to be helpful.
He's in a better place.
Yeah.
No, let's stay in the kernel. Let's find it.
Yeah.
Yeah. I like that. Just leave you with a brief story. In Moab, I took care of this sweet, sweet lady. She's an artist, watercolor artist. She got leukemia. I delivered one of her grandbabies during her treatment. I took care of her daughter, her son-in-law, her husband, all through the whole process of her having cancer. And she went through chemo, she did the radiation, and I took care of her while we hospitalized her multiple times during those things for neutropenic fevers and all kinds of really tough things that people go through with. And when you're in the rural areas, I'm the one managing all of it. It's not admitted to, you know, the Huntsman Cancer Center in Salt Lake. Oh. It's me. And so, and I'm on the phone with these oncologists. And anyway, so really, really involved with this family, and got treated, went into remission. And then about a year later, she came to the office, and luckily she was pretty close I think she was my last patient of the day. and she came in, and just the level of caring that I had delivered to this family for all of the grandbabies and all their well child checks and all their visits, and to the grandpa, to dealing with him and his depression about his wife having cancer. It's just deep. It's just heavy. And she came in that day, and she said, "Well, Doc, the cancer's back." And there was a moment of silence, and I said, "Okay, what are you going to do?" Because we knew how heavy that trip had been for her, that journey. She says, "I'm going to take my grandbabies, and I'm going to go." She said, "I'm going to go swim in Lake Powell because I have a trip planned with them." And it was just beautiful. And just that she could look at death and cancer and just smile. And to me, that was just...
the prospect of death can allow one to appreciate life so much more.
Yeah.
And she's like, I know what's precious, and my life is precious, and I'm still alive, so I'm gonna do something that feels...
And she got it. And to me, I wept so much. But it wasn't because I was sad. It was just because I love her, and I love her family. And it was good. It was actually really...
You're in the kernel.
Yeah.
Yeah, and that's where life is meaningful. That's where we feel most alive.
Yeah.
And it's often we feel most alive in a bittersweet state. Life isn't only the pursuit of happiness. You know, in our Constitution, it's like, well, it's the pursuit of those moments.
Yeah.
Yeah.
This has been such a good podcast for me. Thank you so much. I've learned a lot, and I hope it's helped my patients, my clients, and the community. I love the idea of just giving us permission to be in those moments and to experience them and to find the kernel, because it's there, and recognize the distortion if it's messing with our thinking, and then develop the skills to pull those distortion lenses away and see it for what it is. That's really cool. So thank you so much, Dr. Spangler.
Well, my pleasure. Thank you for the invitation.
This was fun.